Bismillahirrahmanirrahim. The topic of discussion in this video is ARVC or Arrhythmogenic right ventricular cardiomyopathy or Arrhythmogenic right ventricular dysplasia. It's one of the leading causes of death worldwide in young adults, and it's the second most cause of sudden cardiac death in patients with age less than 35 years. It's an inherited autosomal dominant myocardial disease, and it's caused by fibrofatty replacement of the right ventricular myocardium. The main ECG features of ARVC include the presence of epsilon waves, and the epsilon waves are small deflections just after the QRS complex, as will be evident in the upcoming ECG examples. And secondly, the ECG changes in leads V1 to V3. Number one, the QRS complex, there is a broadening or localized broadening of the QRS complex more than 110 milliseconds. And secondly, there are T wave inversions in V1 to V3. And thirdly, there are some changes in the S wave. The upslope of the S wave is broader than the R wave duration. So these are the changes in leads V1 and V3 that are to be focused for the diagnosis of ARVC. And thirdly, there are chances of the presence of paroxysms of ventricular tachycardia with LBB morphology. LBB morphology indicates the origin of ventricular tachycardia from the right ventricle. Now let's view some ECG examples of the ARVC. ECG is an example of ARVC. Just focus on the QRS complex duration in leads V1 to V3, and then in other leads like V4 to V6 and the limb leads. So it's evident that a QRS complex is broader in leads V1 to V3. Additionally, there are T wave inversions, and if I just maximize it or focus it, we can clearly see the presence of a small deflection or a small wave followed by the QRS complex. This is an even more clear picture of the epsilon wave. Note the arrow that indicates it. In this picture, the ECG shows the typical broadening of the upstroke of the S wave in case of ARVC. This ECG indicates a wide complex tachycardia or the ventricular tachycardia with LBB morphology. And to elicit the morphology as LBB morphology, just focus on leads 1, leads V5 and V6, which have a positive deflection and a broad QRS complex with a notch. So the LBB morphology indicates that the origin of the ventricular tachycardia is the right ventricle. So this was all for the discussion of ARVC. I hope you liked the video. Thank you very much.